Right now, somewhere in America, a retired school teacher is opening a Medicare bill she doesn't owe. A 74-year-old veteran is skipping his blood pressure medication, not because he can't get a prescription, but because nobody told him it might be free. And a widow on a fixed income is draining the last of her savings to cover hospital costs that the government was already supposed to pay. Millions of seniors across this country are paying Medicare bills every single month that they may not legally owe. Hundreds of dollars, sometimes thousands, year after year. And the most painful part? Most of them never find out. Medicare is one of the most powerful benefits you will ever receive, but it is also one of the most confusing systems ever created. The rules change, the paperwork piles up, and insurance companies, well, they don't exactly rush to tell you what you don't have to pay. Today, we are changing that. Today, we are revealing 7 Medicare costs that millions of seniors may be able to stop paying right now if they simply know the rules exist. Stay with us, because by the end of this video, you may never look at a Medicare bill the same way again. Here's a question. When did you last sit down and truly review your Medicare benefits? Not skim a notice, not toss a letter in a drawer. Actually review what you are and are not entitled to receive. If you're like most retirees, the honest answer is not recently, maybe never. And that's not your fault. Medicare is complicated by design. There are 4 main parts, A, B, C, and D. There are supplements, there are advantage plans, there are income adjustments, assistance programs, and exemptions buried inside bureaucratic language that even some insurance agents struggle to explain. The rules change every single year. Programs get renamed. Income thresholds shift. New benefits are quietly added, and unless someone tells you directly, you'd never know they're there. But here's what the insurance industry understands and what they're counting on you not to know. Most seniors assume that if Medicare sends them a bill, that bill is correct, that every copay is unavoidable, that every premium is fixed, that every out-of-pocket cost is just the price of getting older. That assumption costs American retirees billions of dollars every year. We've spoken with retirees who avoided going to the doctor for months, not because they were feeling well, but because they were terrified of what the bill might look like. We've heard from seniors who skipped medications, cut pills in half, chose between groceries and prescriptions, all while sitting on benefits they never knew they had. That ends today. Let's start with number 7, and I promise you, this one surprises almost everyone. Cost number 7, preventive screenings. Now, I want you to think about the last time you went in for a routine checkup, a wellness visit, a cancer screening, a mammogram, a colonoscopy, and felt that knot in your stomach, wondering what it was going to cost you. What if I told you that for many of those services, you may owe nothing at all? Medicare covers a wide range of preventive services, often at zero cost to the beneficiary. We're talking about annual wellness visits, cardiovascular screenings, diabetes checks, certain cancer screenings, and a growing list of vaccines, including flu shots, pneumonia vaccines, and more. According to Medicare's official guidelines, many of these services are available at no cost when performed by providers who accept Medicare assignment. And yet, seniors are skipping these appointments every single day. Not because they don't care about their health, but because they assume there will be a bill at the end of it. Prevention is almost always cheaper than treatment. Medicare knows that. That's why these benefits exist. But if preventive care surprises you, wait until you hear what we've found about prescription costs. Cost number 6, and this one makes me angry every time I talk about it. Right now, there are millions of seniors in this country who qualify for a program that can dramatically reduce, or in some cases virtually eliminate, their prescription drug costs. And the vast majority of them have never heard of it. It's called Extra Help, also known as the Low-Income Subsidy. Extra Help is a federal program that assists Medicare beneficiaries with limited income and resources in paying for their Part D prescription drug costs, including premiums, deductibles, and co-payments. Depending on eligibility, qualifying seniors may see their drug costs reduced substantially. Some may pay very little, even for brand-name medications. I've talked to seniors who were rationing their heart medication, cutting blood pressure pills in half, going without because they couldn't afford a refill. And when we walked them through the Extra Help application, they qualified. They had qualified for years. Nobody had ever told them. But Extra Help is just one piece of a much larger picture, because there's an entire category of programs, and most retirees have never been told they exist. Cost number 5, Medicare Savings Programs. And this might be the single most underutilized benefit in the entire Medicare system. Medicare Savings Programs, or MSPs, are state-administered programs that help qualifying individuals pay for Medicare costs, including Part B premiums, deductibles, and in some cases, coinsurance and copayments. Depending on your income and resources, you may qualify for one of 4 different MSP levels, each one covering different costs. Millions of Medicare beneficiaries are estimated to be eligible for Medicare Savings Programs but have never enrolled. That means millions of Americans are paying Medicare costs month after month, year after year, that a government program was already set up to cover for them. If your income is modest, if you're living on Social Security alone, or on a small pension, or on limited retirement savings, please look into this before you pay another Medicare bill. And if you think that's something, let's talk about what happens when Medicare and Medicaid work together, because the combination may shock you. Cost number 4, hospital copays, and specifically, what happens when Medicare isn't working alone? If you receive both Medicare and Medicaid, you may be what's called a dual-eligible beneficiary. And dual eligibility can provide a level of financial protection that most seniors don't realize they may qualify for. Hospital stays can generate terrifying bills. The Medicare Part A deductible for a hospital stay is substantial. Extended stays can result in daily coinsurance charges. Skilled nursing facility stays have their own cost-sharing structures. But for beneficiaries who qualify for both Medicare and Medicaid, Medicaid may step in to cover costs that Medicare leaves behind, including certain co-payments and deductibles that a senior might otherwise assume they simply have to pay. The key word is qualify. Not everyone will, but if your income is low and you have limited assets, you may be eligible for Medicaid protections you've never applied for. One conversation with a benefits counselor could reveal coverage you've been entitled to for years. Now, we've been talking about hospital stays, but what about when you need care at home? What about when you just want to stay in the place you've lived your whole life? Cost number 3. And this one is personal for a lot of families. Ask almost any senior what they want more than anything as they get older, and the answer is almost always the same. They want to stay home, not a nursing facility, not a rehabilitation center, home, in their own space, surrounded by the people and the memories that mean everything to them. Here's what many seniors and their families don't know. Medicare may cover certain medically necessary home health services, including skilled nursing care, physical therapy, occupational therapy, speech therapy, and home health aid services under specific conditions. To qualify, a beneficiary must generally be considered homebound and have a care plan ordered by a doctor or other eligible provider. When the criteria are met, These services may be provided at no cost to the beneficiary through Medicare-certified home health agencies. The fear of home health costs keeps some seniors in facilities they don't want to be in. It keeps families making impossible decisions. And some of those decisions don't need to be made because coverage may already be available. Now we're down to the final two, and each one of these gets more surprising. Starting with something so simple, you'll wonder why nobody ever told you. Cost number 2, vaccines. Simple, powerful, and shockingly underutilized among Medicare beneficiaries. Under Medicare, many vaccines are covered at no cost to beneficiaries, including flu vaccines, pneumonia vaccines, hepatitis B vaccines for those at increased risk, and COVID-19 vaccines. Under Medicare Part D drug plans, additional vaccines may also be covered. But here's the thing. Seniors are still skipping vaccines they're entitled to because they assume there will be a charge. They ask at the pharmacy, "How much will this cost?" And when they hear any number, they walk away. If you have Medicare, please, before you skip your next vaccine, call your plan and ask specifically which vaccines are covered and what your cost sharing is. The answer may be 0. And while we're talking preventive care, your annual wellness visit with your primary care doctor is also covered under Medicare Part B, generally at no cost, once every 12 months. This is not the same as a standard sick visit. It's specifically a wellness check, and it's a benefit you are entitled to use. But we've saved the most shocking discovery for last, because this final cost, number 1, is something that some seniors have been overpaying for years, and the reason is something nobody expected. This is the one. If you only remember one thing from this entire video, remember this. It's called IRMAA, the Income-Related Monthly Adjustment Amount, and it's the reason some seniors are paying significantly more for their Medicare Part B and Part D premiums than their neighbors, often without understanding why, and often without realizing they may have grounds to request a review. Here's how IRMAA works. The Social Security Administration looks at your income from 2 years ago to determine if you should pay a higher Medicare premium. If your income was above certain thresholds, you may be subject to an additional surcharge, sometimes hundreds of dollars per month. But here's what most seniors aren't told. If your income has changed significantly since that 2-year-ago tax return, because you retired, because you sold a home or business, because a spouse passed away, because of any major life-changing event, you may be able to request that Social Security reconsider your IRMAA calculation based on your current income. This is called a life-changing event appeal, and some retirees are eligible for a reduction. Some retirees have been paying elevated IRMAA surcharges for years after a major life change because nobody told them they could ask for a review. The process involves contacting Social Security directly and providing documentation of the life-changing event. Official information and appeal forms are available through the Social Security Administration. If your income drops significantly in the last 2 years, for any reason, call Social Security. Ask about IRMAA. Ask about a life-changing event review. That one phone call might be the most valuable call you make this year. Now that you know what may be available, let me tell you what not to do. Because even armed with this knowledge, there are some common mistakes that could still cost you. Mistake number 1, not reviewing your plan every year during open enrollment. Medicare plans change annually. Your premiums change. Your covered drugs may change. Your network of providers may change. If you haven't compared plans recently, you may be paying more than you need to, or missing newer options with better coverage for your specific needs. Mistake number 2, assuming every bill is correct. Medicare billing errors happen. Charges for services you didn't receive. Duplicate billing. Upcoding. If something on your explanation of benefits doesn't look right, question it. You have the right to ask for an itemized bill. Mistake number 3, never applying for assistance programs. As we've covered today, extra help, Medicare Savings Programs, and dual eligibility benefits are available to eligible seniors, but they require an application. They don't find you. You have to reach out. Mistake number 4, not knowing help is free. This is important. There are trained counselors available in every state whose entire job is to help you understand and maximize your Medicare benefits, completely free of charge. They're called SHIP counselors, State Health Insurance Assistance Program. They do not sell insurance. They do not make commissions. They work for you. One phone call to a SHIP counselor could save you more money this year than any investment you could make. I want you to write that down. You spent your life working, paying taxes, paying into a system that promised to be there when you needed it most. Medicare is part of that promise. And the benefits we've talked about today, they are not handouts. They are not charity. They are programs built and funded specifically to protect the people who spent their careers building this country. You deserve to understand what you're entitled to. You deserve to stop paying bills that were never yours to pay. And you deserve to spend your retirement with less fear and more peace of mind. If you take nothing else from this video, take this. Never assume a Medicare bill is correct without checking. Never assume you don't qualify for help without applying. And never assume that the benefits you're entitled to will find their way to you without asking. The information we've covered today, the official resources, the assistance programs, the appeal rights, all of it is real. All of it is available. And all of it is yours to access. We've put the official Medicare and Social Security links in the description below this video. Please use them. Share this video with someone you love who is on Medicare, because the difference between knowing and not knowing these rules could be thousands of dollars every single year. Knowledge protects, and today you are more protected than you were an hour ago. If this video helped you, hit that subscribe button. We cover Medicare, Social Security, and senior financial protection every week. And I want to hear from you in the comments. Which of these 7 costs surprised you the most? Drop your answer below. Your comment might help someone else realize what they've been missing. And coming up next, we're covering the Social Security mistakes that cost retirees thousands every year. You won't want to miss that one. Until then, take care of yourself. You've earned it.